This is ABC-7 News at 6.
Well, some important medical research. Medical devices typically relieve symptoms, but a new technology for older patients suffering from a debilitating and deadly heart condition has been proven to dramatically improve survival. It was designed for the sickest of the sick, and a team of Stanford heart specialists, including cardiologists and cardiovascular surgeons, are part of this research. At 86, John Grigsby still walks a mile and a half every day with his wife, Ginny. But last January, he could scarcely make it across the room.
Like to get up and leave that chair and go into the family room was a chore. I'd be huffing and puffing.
He was suffering from severe aortic stenosis, a dangerous narrowing of the aortic valve in the heart.
Not many patients live a year unless they're treated. And the only effective treatment history has taught us is surgical aortic valve replacement.
Open heart surgery.
Open heart surgery.
Dr. Craig Miller is professor of cardiothoracic surgery at Stanford and one of the investigators of an experimental treatment for older, high-risk patients like John.
Start from the groin and come up through the iliac artery.
Instead of open heart surgery, the new valve is delivered to the heart with this catheter, a far less invasive treatment for high-risk patients. Dr. Bill Fearon is part of the team and associate director of interventional cardiology at Stanford.
Basically using a catheter with a balloon to inflate the valve inside the old one without having to make any incisions in the chest.
Here it is, a cow tissue valve crimped into a stent.
Right now, for the first time, we have something to offer those who heretofore are inoperable.
Results in today's New England Journal of Medicine found a marked difference between two groups of patients ineligible for open heart surgery. Only one group was given the new transcatheter aortic valve implantation. The procedure is shown here in video provided by Edwards Lifesciences. It's typically about an hour long and performed by a team of specialists. At 1 year, half the patients in the standard care group had died, compared to 30% among those who had the transcatheter procedure.
So we had an absolute difference in death rate at 1 year of 20%. The best way to understand that is it took only 5 patients needed to be treated to save one life.
But Dr. Miller acknowledges there is an increased risk of stroke among the transcatheter patients. Also,
17% had serious vascular complications in the trial just reported, again due to the age and the disease in their arteries. So there is a price to be paid.
but there's also a price to be paid not to do anything.
And that price is paid in death.
John Grigsby's grateful for the less invasive approach. He received his new valve 8 months ago and was happy to do his part for science.
And if you don't do some experiments, you're never going to know whether or not something works.
So far, it's worked for him. He and Ginny celebrated their 60th wedding anniversary this summer. Now, the randomized clinical trial is over, but a limited number of patients who would have qualified for the research are still being offered the experimental device at Stanford under continued access by the FDA. And at our website, ABC7news.com, we will link you to that research. Just look under